Selamat sore. Welcome back to another Bali COVID-19 update. This is January 16th, 2022, and my name is Bruce. And the weather is awful, and more flooding last night everywhere in the city, including here. And my wife's power blew out in the war room last night. My room was full of water. The streets were like rivers, and unfortunately, first two deaths that I know of in the Singaraja area, mother and daughter swept away in the river, and rescue squads and police, military, other authorities have been searching for them down by the harbor by my house. But as far as I know, they have not found the bodies yet. Not much of a paradise this week. Okay, the two lead stories. One, the ban on countries revoked, and the second one, the health ministry announces 66 new Omicron cases. Our numbers are going up. The numbers are going up generally. This is not another happy video, unfortunately. There's some good and some bad. The revoking of the ban, good. The numbers going up, yeah, bad. And the weather, awful. If you're interested in seeing any of our cooking videos, I'm going to upload the first one. We were going to film the second one today, but my granddaughter has a high fever, and so the two of us have been taking care of her today. So we'll do it tomorrow and hopefully have one up then next Sunday. So the plan is to have two COVID-19 updates, Wednesday and Sunday as usual, and then a cooking video on Sunday as well. So let's get started with the first main story. The lead story for today, COVID-19 task force revokes entry ban for 14 countries. The decision was made in a limited meeting on January 10th and stipulated in the COVID-19 task force circular letter number 2, 2022 concerning health protocol during abroad travels in the pandemic. So this is official, and it's been announced today in the press too. So same time that they're doing things, they've made something official and announced it. Same time, sounds good. According to the task force spokesman, Pak Wiku, who I've talked about before, the decision was made considering that Omicron has spread to 150 of 195 countries around the world, or 76%. He said if the countries listed are still banned to enter Indonesia, it will hinder cross-country movement to maintain stabilities, including the nation's economic recovery. And meanwhile, the criteria for foreigners entering Indonesia is still as strict as before, no change there. However, the government has decided to equalize quarantine times for travelers, and it is now 7 times 24 for everybody. What about the 7 times 24, the 7-day quarantine? According to WICO, this decision was supported by scientific findings in several countries, such as a study by Brandel and Associates in 2021, where they found that Omicron's incubation period is 3 days after exposure. The early investigation report in Japan in 2022 also stated the virus will peak on the 3rd or 6th days following the symptoms. And additionally, the U.S. Center for Disease Control has recommended a shorter quarantine period after it was scientifically proven that the infection is transmitted on the 1st or 2nd days before symptoms show until following 2 to 3 days. So the 7-day quarantine, the government is saying, covers that. According to Pak Wiku, quarantine aims to find the symptoms as there's a gap between the first contact and when the symptoms show. Therefore, the chance of infection among the public is avoidable. And he concluded, based on recent studies, the new variant symptoms are averagely detected early. That's why 7-day quarantine will suffice. No signs that the 7-day quarantine is going to be changed anytime soon, but I've said stuff like this before, and the next day the government goes and does something completely unexpected. So who knows? But if you are planning on coming here, I would plan on doing the 7-day quarantine. And so we had some good news with the revoking of the ban on the countries. And well, now some not so good news. Health Ministry announces 66 new Omicron cases totaling to 572. The new confirmed cases were found in 33 international travelers and 33 local transmissions. The ministry spokesperson for national COVID-19 vaccination, Sidia Nadia Tarmizi, who I've talked about many times, explained that the symptoms shown by both international travelers and local transmissions were no different. Most of them, she said, had a cough and fever, and so no need for serious treatment yet. Out of the 572 total Omicron patients, 276 have completed their isolation period. And in an effort to combat the case surge, the Health Ministry will intensify testing, tracing, and treatment in regions with the potential of high transmission, such as Java and Bali. As for tracing, the government will increase the ratio in regions with more than 30 positive cases. The military, TNE, the police, and the general public will be involved. Okay, I'm not sure what the general public is going to do. The Health Ministry also assures the availability of isolation centers for those with mild symptoms or who are asymptomatic, and hospitals with sufficient bed capacity for those with medium and severe symptoms. During the rapid spread of Omicron, Ibu Nadia calls on the public to remain vigilant by implementing the health protocols and immediately getting the COVID shots. Okay, and we hear this. And so if you haven't, get your shots. And I'm still waiting to find out about the booster for me and my wife, who doesn't want the booster. We'll see how that works out. Okay, so what are the numbers today? 7-day average for new positive cases is up to 9. And the 7-day average for deaths, 0.3, both on their way up, unfortunately. And yesterday, nationally, new positive cases, 1,054. We're back in the 1,000 numbers again. And deaths, 4. So that's good news. So the cases are going up, but the deaths are low. So that's really good news. Perhaps that indicates the higher transmissibility and the lower severity of the Omicron variant. What about testing? In Indonesia yesterday, 196,420 were tested with a 0.54 positive rate. Okay, going up. 7-day simple average positivity rate is 0.38, also up from the other day. What about Bali? Over the last 7 days, up to 14th of January, 44,338 individuals were tested with a 7-day positivity rate of 0.14%. And some good news in the vaccination numbers. Vaccination first dose, 3,884,536, 86% of the population. Good. Second dose, 3,170,289, 70.2% of the population. Okay, we hit 70% fully vaxxed. Well, if we consider 2 doses fully vaxxed. Great news. And 12,440 additional doses were administered yesterday. Vaccinations going on like mad. New cases in Bali yesterday, 7. Recorded COVID-19 deaths were 2. Active cases in Bali up again, up to 99. The numbers not looking good, both nationally and locally here. The good news is the vaccination rate's going up and the death toll is staying low. So we'll just have to wait and see. Coming up is a story about Luhut and what he says, and he says the peak is going to be in a few weeks, and then we should see it decline. And what's happening with COVID-19 cases now in Indonesia. Indonesia COVID-19 cases rising in past 2 weeks, task force. According to the COVID-19 task force spokesperson, Wiku Adhisasmito, he said that the rising number of cases has been anticipated, and it's because of Christmas and New Year's. The government said don't go anywhere, and people went anyway, and the case numbers are going up, as was predicted. According to Wiku, it's clear that the number of positive cases was higher than the number of recoveries. On January 6th, the new daily case numbers were at 553, while there are only 209 recoveries. In order to deal with the rising cases, an in-depth investigation and analysis related to the proportion of virus variants circulating in the community is necessary. Wiku also emphasized that the increase in positive cases, especially the Omicron variant, still largely contributed by international travelers. Thus, the government must ensure that mandatory quarantine policy is carried out strictly in an effort to trace the cases. And what about Omicron in Indonesia? Indonesia's Omicron cases estimated to peak early February, Luhut. The estimation is based on observations of other countries' experiences where the Omicron variant reaches its peak at a range of 40 days, which is faster than the Delta variant. However, he said, what we already know, that most Omicron patients are expected to experience mild symptoms, so the government has prepared a different strategy than the one that was used handling the Delta variant. He said, we don't need to panic but remain vigilant. Common refrain from the government. He emphasized that Indonesia is more prepared now to face the Omicron than with any previous variant, and this readiness is supported by higher vaccination rates, higher testing and tracing capacity, and much better prepared health system in terms of medicines, hospital beds, health personnel, oxygen, and centralized isolation facilities. However, the minister noted, we will not be able to achieve success in controlling the Omicron variant without the cooperation of all parties, especially in following the health protocols. So that means wash your hands, wear your mask, social distancing, some of the things that people are forgetting to do these days. Relief Reservations Indonesia rolls out booster shots for general public. The elderly, defined as those over the age of 60, I'm 72, so I'm elderly, and the immunocompromised people have become the latest recipients of the free third dose of vaccines at local health facilities. That's in Jakarta. The booster rollouts began as numbers of virus cases increased as we have people coming into the country, bringing in Omicron with them. And even though the government has been discouraging people from going overseas, people are doing it anyway. There's a big bumblebee right over my head. President Jokowi took to the air in a nationally televised announcement on Tuesday to ask people to get vaccinated. He is encouraging people to get more vaccinated, first vaccinations, second vaccinations, the booster shots. As of Wednesday, only 118 million out of the country's 270 million people have been fully inoculated. Meanwhile, only 9.5 million of the nation's elderly, or 44% of the target in this age group, are fully vaccinated. Nearly half of the country's 144,000 COVID-19 related deaths are from this age group. Okay, so I'm in a high-risk group. Despite the fanfare of the booster program, concerns over the impact of its rollout on the national goal for COVID-19 vaccinations continues to linger. The head of the Indonesia Technical Advisory Group on Immunization, Sri Rezeki, said on Monday the government should not lose sight of its goal to inoculate at least 70% of the population, even though he said there were strong reasons to administer the booster jab. And a coalition of several groups, including Independent Data Initiative Lapor COVID-19, which I've talked about many times, also urged the government to focus on putting shots into the arms of unvaccinated people, arguing that the equitable vaccine distribution should take precedence over boosters. And the epidemiologist, Dickie Budeman from Griffin University, said that the emergence of Omicron gave the government no choice but to continue the primary scheme alongside the booster rollout. He said, we can't afford to be rigid with the criteria. The government has to start administering booster shots because the efficacy of vaccines diminishes 6 to 7 months after they are administered. And what about the sexual violence bill that I talked about last time? PKS still rejecting bill on sexual violence crime, or RUU TPKS. The Prosperous Justice Party is still insisting on rejecting the bill because it says it lacks policy points that were considered vital in the draft bill. A member of the PKS faction in the House of Representatives, Ledia Hanifa, said the House legislation body has not yet fulfilled her faction's request. Among the points that PKS wish to include in the bill are criminal regulations on sexual freedom or premarital sex, as well as penalties for those who create sexual deviations. As previously reported, a number of DPR members, including Speaker Puan Maharani, expressed optimism that the bill would be passed next week. Intensive discussions in the legislative body have been taking place since last year and have changed the name of the bill from the previous bill on the elimination of sexual violence to the Sexual Violence Crime Bill. And according to Ibu Lydia, it's important for her faction to include the principle that sexual relationships outside of marriage can be criminally prosecuted, as religious principles are fundamental. Let's get religion into sex. We see that our culture cannot be equated with the notion of consent as set in Western countries. In addition to PKS, who wants to criminalize sex, the United Development Party, PPP, also wants regulations in which premarital sex can be penalized, and the Golkar Party has asked for the ratification of the bill to be postponed for the next few months until all parties can have the same view. And because of ITE, I'm going to keep my comments to myself right now. So what's happening in Bali in terms of the economy? Central bank upbeat about Bali's economic recovery in 2022. Rising consumer spending, that includes us, and fewer mobility restrictions portend an optimistic outlook for Bali's economy in 2022, according to Indonesia's central bank. According to Bank Indonesia's Bali's office head, Trisno Nugroho, Bali's economic recovery will continue into 2022 with a projected growth of 5.4 to 6.2% year on year. Wow, that is some good news. What about Bali's economy right now? Well, as you know, the first year of the pandemic, we were working around negative 12%. And this year, we've had good signs of things recovering. Although obviously, if you watch any of the YouTube videos, you'll see empty streets in Kuta, in Legian, in Lovina, in a lot of places around, Padangbai. When I did mine, Ubud. But overall, Bali's GDP in 2021 has been projected to contract by 1.4 to 2.4% year on year. Okay, so that was the projection. But now the island has been projected to record a 2.1 to 2.9% year on year growth in the last quarter of the second year of the pandemic. That's great. And where is that coming from? A lot of that is coming from domestic tourism. What about 2022 and this projected growth? Part of this is projected on international tourism coming back again. Is that a safe bet? Here we are, this is January 16th, okay? Still not getting anybody coming in other than the B211s coming in through Jakarta. But we have the MotoGP coming up, what is that, in March? And this is the year of the G20, and so the government is expecting a lot of money coming in to the country as delegates and other people show up here. And of course, there's no telling what's going to happen with the pandemic. Maybe after Omicron spreads throughout the world, we'll be spared and we won't have another one coming in and we can get back to some kind of normal, the new normal, whatever we're going to call it, once we can stop wearing masks and stop getting vaccinated and go back to living our lives regularly. Of course, as I've said many times before, here in Singaraja, things are pretty regular. What's happening in Bali with the Omicron spread? Bali Task Force prepares 1,500 beds to anticipate Omicron spread. The province's task force has managed as many as 700 beds, and 800 beds are being managed by the task force of 9 districts and cities in Bali. According to the secretary of the Bali COVID-19 Handling Task Force, Imade Renton, who I've mentioned many times. And we still don't have any confirmed cases of Omicron in Bali. However, he said that they are preparing 6 anticipatory measures just in case. And now this is interesting in this article because listen and see if you hear 6, because I don't. First, control has been tightened at the country's entry points by implementing a quarantine policy. Second, tracing, testing, and surveillance have been intensified. Next, efforts are being made to boost COVID-19 vaccination coverage and expand the use of the PL application. And as I've said somewhere else, I tried to update mine and it wouldn't update. So what's that about? Fifth, COVID-19 referral hospitals have been prepared and at least 1,500 beds have been ready to isolation centers, according to the secretary. Okay, where are the 6? I missed them. Sometimes this happens in these articles. And what's happening in Bali with quarantines? Head of BNPB review quarantine hotel for PPLN in Bali. I love initials. The head of the National Disaster Management Agency inspected 2 quarantine hotel locations designated for foreign travelers, which are the PPLN in Bali on Wednesday. Suharyanto, who also serves as the chair of the COVID-19 task force, said that the hotels were ready for accommodations so that the PPLN would not have to wait too long at the airport. The review is carried out to ensure the readiness of the province of Bali if Igusti Ngurah Rai International Airport is opened as one of the entrances for PPLN. The two locations reviewed by the head of the National Disaster Management Agency were the Hilton Garden Inn and the Hotel Vaccination in the Kuta area. Never been to either of them. The review focused on the flow of PPLN arrivals when they arrive at the hotel. So within 1 hour, foreign travelers must have moved from the airport to the quarantine location. This is in order to avoid crowds at the airport. Secondly, to minimize contact, the entry route between general visitors and quarantine patients must be distinguished. Additionally, the head of BNPB asked for strict supervision of quarantine patients by health workers. And this supervision should be carried out directly by health workers who visit quarantine location at least 2 times a day. Oh, is it windy outside right now? 17 kilometers per hour for those of you that like kilometers per hour instead of meters per second. And so I'm inside, and even inside here you can feel the wind. What's happening in Buleleng with vaccinations? New variant of COVID-19 appears. Buleleng Health Office intensively conducts follow-up vaccinations. So the Buleleng Regional Health Office continues to aggressively carry out follow-up vaccinations for children aged 6 to 11, 12 to 17, and the general public, and elderly, and people with disabilities, and everybody. In addition, the Buleleng Health Office is also preparing a plan for the implementation of the 3rd dose of vaccine, the booster, which will be soon implemented as soon as the local health authorities get information from the central government. Okay, that's what we're waiting for. Right now, the head of the Department of Education, Suchipto, said that they are currently focusing on vaccinating the children ages 6 to 11. And my granddaughter, Zoe, is getting her 2nd shot on Monday or Tuesday. In addition to focusing on the children, there are also scattered people around Buleleng that have not gotten their shots yet, and so the government is looking to get them vaccinated as well. And for those scattered people who have not been vaccinated yet, the Buleleng Health Office has set the Puskesmas to remain at standby and serve vaccinations for the community with the currently available vaccine stock. And regarding vaccination for people with disabilities, Suchipto said that he hopes that in the future the community participation will help those people with disabilities so that they can be vaccinated as well. And so if you're in Buleleng and you have not been vaccinated, you need to talk to the local Puskesmas or check with your Peduli Lindungi app. Although I tried to update mine and it wouldn't let me. It won't let me see my vaccination certificate because it says update. And when I go to update, it shuts down. Still working on the PL app, I guess. Okay, more on Bali. Now here's an interesting one. Crowded audience and attended by governor. Police disbanded music concert. So there was a music concert taking place in Bangli, and it was supposed to be for the inauguration of the Bangli City Square. I haven't been in Bangli in a long time. I'd like to get there, but I'm not traveling around the island during these days with this weather. And so there was this concert. And the concert was also attended by the governor. This has gone viral, this disbandment, because, the governor was there, and there were a lot of celebrities and local bands and a lot of people, and so, it's gotten press. The Rise of Bangli Event Management Company spoke up about this and apologized for the inconvenience to all parties. At the event, which included, among the governor, local Balinese bands No Stress and Painful by Kisses. Interesting names. I've never heard the bands. According to the chairman of the event organization, he said that they had obtained permission to hold the activity, but due to inclement weather and several other conditions, they weren't able to hold it when it was planned. And the permit was for 750 people out of a 1,500 people capacity. And that's in accordance with the health protocols, 50%. However, this was delayed, and so the committee acknowledged that they couldn't do it on time. So apart from being constrained by time that did not match the permit, the committee also did not predict the number of spectators because people came in much greater numbers, apparently, a large number of people. Because, well, according to the article, people want to get out and see concerts and do stuff. And yes, they do. And sure, I think you could expect, if there was going to be a concert here at the harbor, I'll bet there would be a lot of people. So the chairman was appropriately apologetic for the problems, and Anga from the band No Stress thanked the committee for their hard work and apologized to the audience for No Stress's short performance because it was quickly disbanded. And he added, but we appreciate you guys for staying orderly with such a situation. Good. Hopefully the next meeting can run more smoothly. Okay. It can't be easy trying to organize anything these days, an event of that size. So unfortunate that had to end that way. And more on Bali. Thousands of prospective migrant workers in Tabanan get booster vaccination. 1,653 people receiving booster vaccinations in Tabanan. Prospective migrant workers. And the vaccine dose is different from the previous vaccine. If the first and second vaccines are half dose, then the current is only 25 or 1/4 dose, meaning that it's lower than the previous dose. When the boosters were given to the PMIs, that's the name for the prospective migrant workers, right? It was directly monitored by the regent and the deputy regent and the regional secretary and the head of Tabanan Health Services. So this had some big guns there. The head of the Tabanan Health Office, Dr. Newman Cecilia, said that the booster vaccination could be carried out in Tabanan because they were given permission by the Ministry of Health and the province because the first and second vaccinations have exceeded the target of more than 70%, and they're now in Tabanan at, according to this, 96.4%. Cecilia said that the booster was given to the prospective migrant workers because they asked for it, because they said they needed it for employment. And therefore the government was giving priority to the PMI so they could get overseas and get to work and send some money back to their families. Good. And when asked about whether there's side effects or symptoms that arise when the first and second types of vaccine are the same or different from the third or the booster, Dr. Cecilia explained that different types of vaccines given were no problem. One example is a PMI receiving first and second doses of the Sinovac and the third dose with AstraZeneca. And he said, from existing research, if vaccinations received are the same, as well as if they are different. What's clear is that so far there has been no side effects from the vaccine using the same or the different from the third shots. Time for a wrap-up update, and let's start with the weather. I'm surprised there's some controversy about the weather. Okay, the temperature right now is 31.1 degrees Celsius, and the humidity 79%. Yes, and right now the wind speed is at 12.1 kilometers per hour. And I'm going to tack a little video on at the end of this to to show the wind yesterday, so you can get an idea of what my little machine, when it registers and I say it's this much, what it looks like from up on the roof, and taking a look at the tree and the ocean, so you can see that. Okay. Well, at least I'll get a few laughs out of the weather. That's about it otherwise. And updates, nothing really to update right now. What about a wrap-up? The wrap-up is the numbers are continuing to climb as was expected after the holiday period and with the introduction of Omicron into Indonesia. Still no reports of Omicron in Bali, which is kind of strange. Vaccinations going on. My granddaughter was supposed to take hers on Tuesday, but she's sick, so I don't know what that's going to happen. And the revoking of the ban. Okay, good news. Is the airport open for direct flights? Yes. Are there direct flights? No. Can you still come to Bali? Yes. You have to go to Jakarta, and you have to go through the 7-day quarantine. And just like I said the other day, you're taking a risk of testing positive and being locked up. So That's up to you. And with the weather like this, I would not want to be here right now. If I could be somewhere where it's sunny. Yesterday I was talking to a friend of mine in Turkey and it looked so nice there. I was so envious. I said, I want to be in Turkey right now. Because here, wow, every day it's the same. It's okay in the morning, then in the afternoon, you get the high winds, the drizzle, and then at night, and of course the power always goes out and the house always floods at night when you can't see anything. And some disappointing news on the sexual violence bill, and well, where is that gonna go? I don't know. I'm not gonna make any more comments about my opinion about that. I'm just gonna stick to straight reporting on it because, well, I have a lot of opinions about it, as you may imagine. Okay, that's it. If you found this useful, please give it a thumbs up. If you haven't subscribed, please consider subscribing. There's going to be a short clip here between the end screen and this. It's the weather video. So thanks for viewing. Stay safe. Be kind to someone today. And I will see you on Wednesday. We're up on the roof now and measuring the wind speed. Here's my measurement and you can see, what do we got there? Okay, this is 29.1 kilometers an hour, and this is what it looks like from the roof. Now, I was looking at a website, they were saying 29.1 kilometers an hour is not that fast. You get some leaves blowing. You can see what this wind is like here. So either my little meter here is not recording correctly. That's up to 33.3 now. Either my meter is not reading correctly or that website that I was looking at is wrong about the effects of the wind, the speed of the wind, because wow,